Let me tell you something personally. I've been with these people for the past 72 hours. It has not been easy. You can see it on their faces. They are very edgy. They are very, very, they are itchy. In fact, they are itchy with the anticipation of what is to come. And I urge all of us to also wait with that same anticipation and see what has been birthed here. So the Innovate for Impact Designathon is the first kind. It's the main edition of a program that is going to start and continue for many years. And it is a joint collaboration of two youth-led and youth-run organizations, Our Voice as Light Foundation, and the Innovation and Design Thinking Academy, TIDA. And these two organizations are very, very committed to seeing the society, especially in our community in Nigeria, work as it should. And that's why they have partnered together today to bring forth solutions commanded by youth in this community so that we can see how we can impact our society even from the grassroots. Before we get into anything, I would just like to invite I messed up. I forgot to introduce myself and my wonderful, wonderful steering committee members. And it will be a very honor if I don't. They have worked really hard. We have all worked to put together this wonderful program. My name is Angela Idiri. Thank you very much. I'm a fifth-year medical student at the University of Ibadan, and I'm just committed to seeing my community grow and helping people. With us on the steering committee, we have Mr. Yusuf Babatunde, co-founder of the Design and Innovation Thinking Academy, Innovation and Design Thinking Academy. We have Mr. Abdulhamid Babatunde, the co-founder of the Innovation and Design Thinking Academy. We have Mr. Mubarak Alimi. Please wave your hand. He's also a member of the steering committee. And in absentia, we also have the founder of Our Voice as Light Foundation, Mrs. Bilkis Omoyeni Ayeni. She's not here today, but she's with us. She's with us, and you're going to be hearing a few words from her soon. So I'd just like to invite Mr. Yusuf Babatunde to tell us more about what TIDA does and what Designathon is about. Thank you.
Hello everyone, good morning. Thank you so much for being here. It's really our pleasure, our honor to have you all here. My name is Yusuf and I'm one of the co-founders of TIDA. And basically what TIDA does is to equip Nigerian youth with 21st century skills, innovative skills, design thinking skills, because we believe when young people are equipped with these resources, with these skills, we are capable of making amazing changes in our environment and in the world at large. So we came up with this program since January. Omoyeni reached out to us and says she has this idea and she would like to work with us to make this a reality. And so it's been an intensive planning process in January. For the past 7 months, we try to make sure that we can gather young people together, give them some trainings, give them problems to solve and how they can come up with solutions, and even be able to visualize it in just 72 hours. But since Thursday evening, none of the participants have met each other before. It was the first time seeing one another, and they were able to form teams, they were able to address solutions, organize training sessions. It's been really, really amazing. We've been very, very glad. And just to also share some of the activities. So on day one, they were exposed to sessions on design thinking, the phases of design thinking, on how to use prototyping tools, how to get to the root cause of the problems, how to come up with ideas, how to brainstorm, how to ensure that they can test the ideas before they scale up. And we also had many engaging sessions, many scavenger hunts to just promote team building as well. Then on day two, we give them more exposure on how to pitch the ideas, how to use storytelling, how to design their pitch decks, right? Also, how to use user journey maps. These are tools that are very, very relevant if you want to effectively communicate your ideas to the audience. And so it's been very, very energy sapping, it's been brain busting. They've not slept, literally. But I think some prefer to not even eat. They just want to come up with the ideas. They've been working on perfecting it and making sure that they deliver it effectively today. So welcome everyone again. And today is the final presentation where you get to hear what they've been working on in the past 72 hours. So we wish you a very amazing time. Thank you.
So we also have a video presentation from Ms. Omoyeni Ayeni. So she has sent us her words so that we can feel her presence here as well. So Abdulhamid.
Welcome, congratulations, and thank you to everyone gathered here today. It is such a pleasure and an honor for me to welcome you to the two highly impactful programs that will be happening in this hall. First, we have the pitch presentations for the Innovate for Impact Designathon. We also have the final award presentation ceremony for the Art of Peace Community Challenge. Now, both of these programs are aimed at understanding how we think of peace and how we can build peace in our communities. Whether it is saying that no child is deprived of proper education in Nigeria, or envisioning a future where no Nigerian has to battle with unemployment or underemployment, or imagining a community where everyone has good access to proper sexual and reproductive health care. So peace really could be anything we make it to be. And for the Art of Peace Community Challenge, we had 110 distinct submissions expressing different ideas of peace through different art forms. And for the Innovate for Impact Designathon, we had 245 brilliant and highly driven Nigerian youths express interest in getting the resources and skills to develop peace by innovating solutions that address 4 different sustainable development goals. Earlier, I said congratulations to everyone here, and I mean it. Congratulations to the 5 finalists of the Art of Peace Community Challenge, whose artwork, out of 110 entries, were deemed to be the most creative, the most original, and the most emotionally impactful expressions of what peace means in their communities. Congratulations to the 27 participants of the Innovate for Impact Designathon, who were selected out of a pool of 245 interested youths to join this community of innovators. These 27 people have now created human-centered, innovative solutions to the real problems that concern all of us. And congratulations to my fellow steering committee members who have put in so much work and effort to bring these 2 programs to fruition. Despite multiple sicknesses, tests, examinations, and even professional examinations, these members have come in every day with so much energy to make sure that this becomes a reality. So congratulations to all 5 of you for your success today and for being an inspiration to this community. And within the steering committee members, we have the 2 co-founders of the Innovation and Design Thinking Academy, also known as TIDA. Abdulhamid Babatunde and Yusuf Babatunde were the 2 sounding board when I first brought up the idea of the Designathon. And over the past 2 days, they have organized great, informative, insightful, impactful, interesting, engaging sessions. And these are not my words, these are the words of the 27 participants who got to experience these sessions. Even though everyone complained about how long the sessions were, everyone got to learn how to get to the root and underlying causes of problems, and how to brainstorm solutions, how to analyze the strength of the solutions, and how to design these solutions with empathy in mind, how to innovate with the users in mind while eliminating or reducing biases and assumptions and judgments. Congratulations to the both of you for your inspiring success. To the judges and peer facilitators, I'm also congratulating you for being trailblazers in your respective fields and building a path for yourself, so much so that you are now role models for the rest of us. And congratulations on the support systems who have helped us so far. From the Davis Project for Peace, who sponsored this project, to the application reviewers who volunteered their time and efforts to review all the applications that we received, the videographers and photographers who are documenting the progress of our success, To the guests, every single person seated here today who is here to support someone, or just cheer someone on, I congratulate you on being a part of this brilliance that you're about to experience. Today isn't about winning or losing. It's about expression of ideas. It's about getting a glimpse into the future that has the potential to exist. It's about supporting and cheering on the 32 people who will be presenting today. It's about seeing the impact of 2 youth-led organizations, our Voice as Light and the Innovation and Designathon Academy, and the kind of impact we can have on youth and Nigerian at large. Today, we will witness the influence of peer mentorship on innovation. So again, thank you very much to everyone here today, and a huge welcome. The next few hours will be an experience, and I hope you're excited to embark on this experience.
They are competing for a total cash prize of 600,000 naira. And so our third place team will be taking 100,000 naira. The second place team will be taking 200,000 naira. And the winner of the Designathon will be taking 300,000 naira home. Alright. So it's a competition. The Designathon is a competition. Yes, wonderful prophet. Alright, I think this will be better. Oh God. Wonderful solutions are going to be preferred here. Wonderful solutions are going to be preferred here, but at the end of the day, the reason why we've made this a contest is to get the best out of everybody. Healthy competition actually breeds innovation, and we've seen it play out here. We've seen some very tricky interactions amongst our participants, and we can't wait to see what this competition has brought about. And so, to judge this competition, we've invited 4 very special guests who are going to judge skillfully with the criteria that they're going to read out to you. Our guests are very distinguished in every one of their fields, and I will not be reading their citations for want of time, but just know that you are in the presence of some people who have done really amazing things for societal impact in Nigeria. And so I'm going to be inviting to the high table Dr. Olushola Ayola, who is the founder of the Robotics and Artificial Intelligence Nigeria. That's it. Thank you very much, sir. Inviting, this is Adejoke Asisi, who is the founder of Planet 3R. Thank you very much, ma'am. I'll be inviting Dr. Simpa Dania, the founder of HealthStar, and Mr. Ibrahim Oredola, the founder of Skills NG. Thank you very, very much, guys, and Ma, for honoring our invitation. We are very, very pleased to have you on this, and we look forward to seeing how this is going to all play out. In our presence today, we also have some esteemed guests, all the way from Lagos. Please give a warm round of applause for Mrs. Musiat Oshodi. Thank you very much, ma'am. And Mrs. Damilola Oshodi. Thank you very much, ma'am, for honoring us with your presence today. Thank you for gracing us. We're very pleased to have you. And our lovely guests, we're pleased to have you as well. I hope you're really excited about what you're about to see here today. We're about to start with the pitching, but before we go ahead, I'm going to allow one of the judges to read out the criteria on which they will be judging our teams. Thank you.
We'll be judging on a number of criteria. One of them is problem identification. You should be able to prove that you've identified a problem and that's what you're trying to solve. Then the second is the problem-solution fit. So you must be able to express your solution in a way that we can see it really addresses the problem. Novelty and creativity. Let's see that the idea is not something that has already been, deployed in this place, or something that has already been thought of somewhere? Well, if it's new in this area, then great. If it's new globally, also great. Also, feasibility, is it workable? I know some ideas are great on paper, but for those who have experience, they can quickly see if it's feasible, practicable, or not. So we want to see that.
I want to invite one of our facilitators, Mr. Korede Adegeji, to come and tell us how the pitches are going to be timed.
Okay, thank you very much. So every team has 5 minutes each to pitch and 5 minutes for question and answer. So after pitching, so we're doing your pitch, I'll give the go ahead for you to start. Then once it's 3 minutes left, they will say telling you it's 3 minutes left. That means you have used 2 minutes out of 5 minutes. And once you have 1 minute left, this should show you that you have 1 minute left. So, and once the time's up, you will hear the ringer. So once time's up, please stop. There is no extra bonus for going above time. Then after you are done pitching, we will then have 5 minutes for question and answer. So the judges will ask all the questions. Then you then have ask the questions. Within that same 5 minutes, you have to answer as much as you can within 5 minutes. Is there any question about that? And during the course of your pitching, if your slide goes off or anything goes off, your time still continues running. Thank you very much.
All right. And so all the rules have been laid down. We've heard the criteria for timing, and now we are ready. We are ready. So prior to our teams actually did a ballot to see who was going first. To see who was going to be going first to pitch to us. And so every participant of every team except team 1 should please exit the auditorium. Every participant of every team except team 1 should please exit the auditorium now. So, team 1, are you ready? Team 1, are you ready? Yes. All right.
Miriam Danjuma is a 9-year-old girl who has lived in 3 different IDP camps since she was age 5. Miriam stopped her education in primary 1 first term, and she does not know how to read and write in English, and she has poor numeracy skills. Just like Miriam, according to the Internal Displacement Monitoring Center, children contribute to 60% of the 3,346,000 internal displaced persons in Nigeria. And these children go on to contribute to the 10.5 million children who are out of school, according to the UNESCO report 2021. These children in the IDPs face 2 problems: lack of access to education or unstable access even when there is education. This now facilitates the need for a community-based learning and a self-paced learning system. We are Project Scholar. I am this is Victoria, this is Angela, and this is Ella. And we are Project Scholar. Scholar is here to bring school to the students. Scholar provides mobile education kits to children in internal displaced camps so that they will be able to increase their literacy and numeracy skills when they are within the ages of 6 to 11 years. At Scholar, we do 2 things. We provide mobile education kits, and we also provide a community-based, volunteer-facilitated learning system. The mobile education kit, the Scholar mobile educational kit, it consists of the talking pen and book and an erasable writing pad. This talking pen and book works by reading out loud when it is placed on a book. It has the capability to read in English language, to read in Hausa language, and to read in Pidgin language. For the erasable writing pad, it is very sensitive to finger movement. So the very moment a child uses their finger to write on this erasable writing pad, they would be able to eliminate the need for school books, for writing pencils, for writing pens. And this erasable writing pad can be cleaned with any piece of clothes. The Scholar educational system also provides a community-based facilitated learning in the sense that we'll be bringing in volunteers who would provide a friendly environment. These volunteers will be trained on how to speak to children. These volunteers will be trained on how to facilitate learning with children who are placed specifically in the IDP camps. The Scholar Kit is going to be powered using the battery. In 5 years, Scholar aims to impact 1,000 IDP children by providing them with our Scholar mobile education kit. We are going to do this in partnership with Amnesty, Rivet, the UNHCR, Federal Ministry of Education, and the private schools. We plan to pitch this to private schools who would invest by buying it for their children, for their students. When a private school buys our Scholar mobile education kit for 2 children, that means 1 child in the IDP will be funded, and the other money will now be used to sustain the company. So here it is. It is enabling IDP children, increasing their literacy and numeracy skills, enabling one with a Scholar kit, bringing schools into the IDP tent. Thank you.
Maybe if Scholar was there, I would have had a mobile education kit that I would easily have been able to carry around. Please, another round of applause for this team.
It was a wonderful presentation, and I actually relate to the problem. So Nigeria actually has one of the highest out-of-school children in the world, and that's actually a very big problem. So I have a couple of questions for you. Number one is, do you own the proprietary to the product? Or will you be owning the proprietary to the product? So that's one. So if not, so how do you want to ensure that the cost is affordable enough for the market? That's one. Then number two, so you are saying you want to market this product to private schools. So are you really sure that there's a need for it at the private schools, and will they be willing to say, okay, they want to buy? And technically, will that not be replacing the teachers that are already paying? And then your curriculum, the talking pen comes with the content, or the talking pen is marketed as just a product, the talking pen itself. So if it's coming with the content, so that means you also be investing in content creation. So how do you want to have your ways around that? So are you taking all the courses at once, or you are prioritizing? So, and then lastly, when you're designing your pitch decks, make sure that you're actually very sure about accuracy of the text. There's particular text you said literacy. When you want to say literacy? Well, thank you. A wonderful presentation.
Regarding the curriculum that is going to be present in the pen, I'm going to relate it to whether we have the full proprietary of the product. Actually, we do not have full proprietary of the product. So the product already it has the books that are in it, which is actually 100 books, are already in line with the educational curriculum of Nigeria specifically. And so textbooks that are going to be, that have already been accredited by the University of Basic Education, are the textbooks that are present inside the writing pen.
Thank you very much for the questions. So as regards the proprietors, and if they are going to replace teachers, actually they are not replacing the teachers, rather they are improving the method of learning for these children. According to the proprietor of the talking pen, the rate at which children actually learned to read and write increased by 35%. Increased by 35% in comparison to the traditional method. So we're not replacing the teachers already, but there's a way of improving the method of learning in primary school education.
What is the reason IDP children are very heavily out of school?
One of the reasons why they are highly out of school in Nigeria is because there's no presence of schools in the IDP camps. We realize that children whose IDP camps are Okay, so like the story we used of Mariam, who has been in 3 different IDP camps. So there's always that migration that also affects education, and there's also the fact, especially in states called Benue, Delta Camp 1, we realized that when the children actually went to the school, they were facing discrimination and there was increase of school fees because they were IDP camp children. When by the time they call you at IDP camp children, it's going to be increasing the number of it's going to be increasing the number of children present in these public schools. So take for instance a public school 75 children. Bringing in more, if the education is not going to be qualitative, and the fact that those children also face discrimination. A child in Benue is going to look at a child class from the outside and be like, I'm better than. I taught with these children, and I've realized that they have that discrimination. They know that they are poor, but they feel since you are more poor than I am, why should we leave them in the same place? And it discourages them.
You're going to have this solution you're providing. I don't know, confirm to me if it's correct or not. Looks like a one-to-one item. Each child must have one, right? Do you not have any possible solution where a group of children can use one smart device where everybody can interact without having to expect each IDP child to have one? And secondly, what's going to be the price of one of this, if you can just give us an idea?
Those 2 questions are interrelated. So the thing about the mobile kids is that it's actually if I use it to learn, I can give it to my younger sibling to use to learn, who can give it because they're IDP children, who can give it to another friend to use it to learn, and that's where the volunteers come in because they are knowing how the progression of how one particular kit is going through. And so you talk about the cost. The cost of this kit is 18,000 naira. But when we compare it to conventional quality primary school education, it is actually cheaper. Because by the time you compare the school fee in schools that have quality facilities, it's actually cheaper.
Thank you so much for the clarity, and but I have a few questions. Number 1, this is Nigeria. Few private schools, in fact, many private schools that I know would not want to buy kits because the way you do it now, you say that when they buy 2 kits, then you'll be able to buy one for one of the IDP camp. So does it mean that your product will be expensive than the normal one for you to be able to get one of the products? Because why should I buy from you when it's expensive when I can just buy from where I'm not part of your scholar, I'm not part of your team. So it is not that I'm feeling like a private school right now. Why should I have to put so much money just to buy your products that I will be buying? That means I will be getting 2 products for the cost of 3, right? Is that what you are saying? So why should I buy it? And also, the way I see this now, it's a good solution. But how do you guys hope to get money? Because if it's not making money, social good must do you good. How does that want to, as the team, what do you want to live on? Because now, the way you said everything, you are not even, I can't see where you are going to be generating the revenue that maybe, because even when you get volunteers, in my organization, I still pay volunteers, we still give them some tips. I'm telling you, you can't just expect people to just come and volunteer and be saying thank you every time. So I really want to know, how are you guys going to make money aside from the fact that you want to give these kids the kids? Thank you.
Sorry, one more question so that you can answer it together. You don't create the product. You don't create the product. The content is already available. So what exactly is your innovation here? Aside from the fact that you are making it accessible for students. So is there any other innovation you are bringing to the table?
I'm going to begin with Madam That's question. I think it came from the side. It came from the side of the private schools, and them not actually wanting to make use of. So we're actually targeting high-end primary schools. So we're actually targeting high-end primary schools. So we're talking about primary schools that are present in places
maybe they bought it for the elder ones before. Now you said that you can pass down. Have you reached out to any of these schools or any of the parents?
Of course, there's been because this was within 72 hours, there's been a slight contact with parents, and parents are located in this place. They feel like it's a good idea. It's technology. We can do this. The parents love these ideas. These schools want to make profit. But love what the parents want for their own children.
I'll share two tips with you. One, I don't think parents will buy it. I think your best target is to target CSR from companies. They are the ones that have it within their, if I use genetic makeup to kind of do things for the idea. Yes. So if you target corporate organizations on their CSR, community, whatever they call it, then you can make money out of this, you can bill for them, and then they're doing social good, you can keep some money for yourself. Two also is, I think the biggest selling point is that you can get a community or group of people in the ID camp to use one. So what they're doing for the Education Project, they're bringing, adolescent mothers, right, to teach them about nutrition without having a healthcare worker, right, in that state. So you give them the pen, and then there's somebody like a class rep, right, that is able to come and, and they reach out. So I think that's setting up a study group, right, will help. So you have that peer collaboration, and you don't need one per person. So you need 1 to 5 or 1 to 10, as the case maybe. Thirdly, this is a Designathon, right? So you might not have answered all the questions, right? About price points, content development, and things like that. But overall, I think it's a worthy portion. Thank you.
The content has already been created. So what exactly is your innovation?
So as regards the product itself, if you remember the cost of the product, this is 18,000 naira. And then we have IDP children who can't read and write, who are out of school. So now the idea is, how will these children be able to read and write, despite the fact that they are being displaced by insurgency, crisis, and the rest? Putting them in a school at that point might not be so feasible, because we can't determine the crisis situation in Nigeria, right? So bringing these mobile telecommunication devices to them, that even in times they are displaced, they can still have these kits along with them in those community, in those their camps. So one of the reasons we are bringing to the IDP is the cost. They can't afford it. That's not their priority. But with the fact that they can have this, free at the rates that we invest and we get investors and organizations partnering with us, these students can have access to quality education, can actually be exposed to reading and writing. Thank you. For SDG 2, Zero Hunger, please give a round of applause to Team Farm Aid. These are my team members. Victoria, software engineer. Rashid, software engineer. Moise, a farmer. Miss Bintu, she's a 45-year-old single mother with 2 children. She's also a farmer. She experienced financial loss last year because her crop yield was very low and they need to poor irrigation system. Now, countries that have invested fully in irrigation system solutions are actually, according to statistics, that they have higher agricultural productivity than countries that do not invest in this. For example, Nigeria, high irrigation problems, that's poor irrigation systems, has been linked to low agricultural productivity and food insecurity. Now, our solution.
We present to you a system that will help you to optimize your productivity. So we do this by helping you to optimize the water usage of your crop. This will also help to ensure and promote good crop health. So with this, with farming, we only try to ensure that every water drop that deliver to your plant camp. So now let's take a walk through the key component of our application. Our application is made up of different sensors, which include rain sensor, humidity sensor, soil moisture sensor, and temperature sensor. So the sensor helps us to collect environmental data through which we train a machine learning model that is connected to, that we deploy on the microcontroller. The microcontroller is connected to actuator. The actuator helps us to regulate the cooking and cooling of our lab. So in addition to this, we have a web application through which you can monitor all this entire application remotely from your own comfort. So then we also have the functionality of customizing the water scheduling at your own comfort.
We have a huge market size for this product. The number of farmers in Nigeria is much. Considering the southwest only, we have about 1.3 million farmers in the southwest only. So, as a startup, we are considering of targeting 1,000 farmers in the next 5 years. So, we want to target 1,000 farmers because of ease of access and ease of monitoring. So, our business model is that we are a social enterprise providing smart irrigation system for farmers so that they don't need to go to their farm every day to irrigate their plants. So, we leverage on the power of AI, organic, real-time data analysis, and sensors to mitigate excessive use of power and increase agricultural productivity. And also, we generate revenue by selling our IoT devices to this farmer and also helping them to install it. Our first project is that we are a business to consumer model.
Okay, so the following activities will be executing for the definition of our solution. First, we will assemble the IoT device there of the interface for personalized monitoring and control, after which the irrigation system will be set up. After that, it's just maintenance, support, and training of the users. Now, for sustainability of our idea will be partnering with organizations about SDG 201. So we're able to apply for the points of which clients. So our go-to-market strategy to reach the farmers. We'll be making them aware of our new solution through farmers associations, through advertising, through social media platforms that they are on, and through input companies that they purchase their inputs from.
This is our simplified user journey. First thing is awareness, then they get to contact us. Then the next thing is consultation. We go to their accounts physically, and there will be proposal of solutions, then we implement solutions, and continuous monitoring. Now, we do not have any competitors currently in Nigeria. Our idea is a novel idea in Nigeria. But we have an international competitor, but the advantage we have over them is that their services are not available in Nigeria. Our farm aid is cost effective in the long run, even though it might be expensive. We provide a instrumental plan available for them to be actually paid to pay. That's for the users. Then we also want to involve the youth by teaching them how to actually assemble these IoT devices and be able to pay them, providing employment for them. Impact is water conservation, which also ensure environmental sustainability and improved resource efficiency. We have a team of capable people and who are actually
the lady that you showed as your partner cannot afford. Cannot afford what you have described. I mean, he's here, so I guess he'll tell us a lot more. I think that the solution is a more, you have a more fit for either a cooperative type farms settlement, right, or a large scale farming environment, not smallholder farming entities.
Yes, I also actually share the same sentiments, and that will lead me to my second question. How much will it cost you to deploy, let's say, an MVP of this product? So, like something to actually test the market with, how much will it cost you to deploy the solution? And how long will it take you to break even? And how much will this cost your average, customer. Yeah, basically the business model.
All right. Well, let me say you have expressed what the problem is. Farmers need better irrigation system, and I think that is not a new problem. But then how we go about solving it is the challenge. And you mentioned that you have a solution, but in my opinion, I don't think you've properly broken down the solution into the various components. You have said everything at once, but not broken it down. For example, you mentioned mobile app. What are the features that farmers can gain from the mobile app? Is it just looking at the current moisture level of their farm? Is it looking at the nutrient level? Is it looking at the weather forecast? Is it looking at for different types of crops? What is the advisory moisture level? Those are the kind of things some farmers might need. A farmer should not be allowed to just turn off or switch on irrigation. For example, if you're planting vegetables, there is some amount of water you should not, otherwise it can become too much and wash off the nutrients. Then secondly, you have not told us about your method of deployment of water. For example, irrigation has two types, right? And these two types, some are good for some kind of crops, some are necessary for some kind of crops. You've not broken down what type, whether you are the one that will install the types of irrigation, and of course what that will mean. Because if you're going to deal with installing irrigation systems, apart from your IoT box, there is going to be pipes, tanks, source of water. For some farms, they don't have boreholes. You need to either fetch from the well or drive it from the well through piping system, which small-scale farms may not be able to afford unless they are working collectively as a group. Then, of course, you mentioned data analysis, but in your discussion of your block diagram, you put a microcontroller, actuator, sensor, and the farm. But you did not put a computer system, like whether it is a microcomputer or an IoT device that will make sure data is being sent to a database. So you did not talk about database management for different farms. Like, I've been involved in a similar project with the federal government, and what they actually want to do or are trying to do is to have data from different geographical zones to even understand what the requirement would be over the year in terms of irrigation, so they can see how well to advise farmers at different locations in the country. So if you are going to do this analysis, you must be able to collect data. You call this an IoT device. That means there must be linked to the internet, but you didn't talk about the method of that. And even if you're not going to break it down to the details, you at least to give us an idea of your understanding of the involvement that will be required. I think that's it from my end. But finally, you mentioned that this does not exist in Nigeria yet. That's going to be difficult to understand. But of course, if there are some additional benefits that have not yet been implemented in Nigeria, then you can talk about that. But at the level of even the government alone, they have had they have had activities in building this. CBN has granted loans in some cases. In this case, so please, maybe 3 days was not enough to do all that finding, but you might find out that there are some people that are doing things like this in some mechanized farms.
What would I say? They answered it all. Anyways, beautiful presentation. I really love your presentation. But the last thing that I just said now about you guys, that maybe you did not look out for your competitors to actually know that maybe something like this exists, or the gap that you are trying to fill that you've been able to identify in that solution that you want to add to it. You feel like, okay, it's not there yet. So that one. Then aside from that, like the first question, that's how do those kind of women, how will they afford it? Especially, you said that you are going to do it through, Sunday again. You want to do instrumental, like they pay regularly. But have you thought about it that some people don't even finish paying? Some people, before they even finish like using the products, they will not pay you again. So how do you sustain yourself with people paying you small? How will that, your organization, how will you survive with that? Thank you.
Thank you very much for the awesome questions. About the mobile application we talked about. So what the basic feature we are going to be bringing to farmers as an advantage of them being getting their farm by themselves as follows. So we'll be giving them updates about the soil moisture, the nutrients through our microcontroller. So the data that is being sent from the sensor will mounted, our IoT sensor will mounted on the computer. So we'll be sending out all those information into their database. So with this, they will also be receiving an alert or notification about when, as a way of sorting their concept before irrigation process should take place. So that is my response for the.
Regarding the question of our personnel and our police, the problem she had was that she lost most of her colleagues due to inefficient irrigation system. So if you can assure her that if you use this system, you can have optimal production of your product, I believe she will be able to avoid it because of we have this payment option of instrumental payment. And for we to ensure this type of payment, we are going to sign an agreement, a memorandum of understanding in between us, so that to ensure that they did not get our device and they did not pay up for our money.
Also for the affordability, we're thinking for people who cannot afford the small scale income, we should think also of like the partnerships we mentioned. If those our partners can help provide it at subsidized rates for the people who cannot actually afford it, maybe they will not be paying from them the instrumental payment, but there will be a significant reduction for them.
About the method of deployment of our training model, that is our machine training model. So we are going to leverage edge imports, which is a platform that we can deploy our database on. So then that is the data we've collected from our IoT sensors. So this data will be deployed to the edge imports. They will help us to train the model more effectively and time efficiently.
For the irrigation practices, the type of irrigation practices, we have not. We need to do more research. For example, you mentioned the kind of irrigation practice. So we plan to partner also with irrigation specialists, land surveyors, and plumbers to actually know more about this, in such that we can actually have. It can be a service for us. So it's another way to generate revenue for us.
Judges, have all the questions been answered? All of them have been answered. Alright, please everybody give a warm round of applause. Alright, now, so we have our third team, Team Health Innovate, who is going to come and present their solution tackling a problem with SDG 3, good health and well-being. As a reminder to the team, you have 5 minutes to pitch.
Good day everyone, we're here to say about the new innovative solution that we have been able to develop over the past 72 hours, which we believe will revolutionize the way young Nigerians living with chronic medical conditions manage their health.
Everyone, let me tell you a short story about this beautiful young lady. This is Mayowa. She's a very student of the University of Ibadan. She was diagnosed 9 years ago with epilepsy. But at the point of diagnosis, she was given 2 medications to be used daily. But Mayowa neglected these medications, and this because it worsened the adult condition. And now she has to use 5 different medications every day for the past 5 years. Now that was very, very unbearable. Now, what is the problem? There is poor medication compliance among young people living with chronic health conditions in Nigeria. Now, what are the causes to identify with this problem? One, there is forgetfulness to use this medication. When patients forget to use their doses, this disrupts the potency of the treatment. 2, poor understanding and education on their health condition. 3, poor complex medication treatment plans. Now, we as medicine have identified these problems affecting this young patient, and now we are ready to help. But how must we do so?
harm. Our solution medicines consists of 3 parts. The first part, which we call the Medication Compliance Tracking App, is an app which we have designed to provide health management services to our users. It consists of custom medication routine creation, alerts and reminders, and also the measurement of health vitals. It is also an IoT app which we have designed to track medication compliance, which will track when users use their drugs, the time they use their drugs, or if at all they use their drugs. The third part of the solution is the telemedicine and consultation services. Now, let me speak the technical user interface. As you can see on the phones here, this is how the user interface is going to look like. We have been able to incorporate these features into the progress monitoring, personalized application reminder, and health vitals. Now, this is the IoT device which we designed ourselves. It is going to be solar powered and battery enabled. So this is our mission. Our mission is to ensure that young Nigerians living with chronic medical conditions have an effective way of managing their health. The vision is to provide people all over Nigeria that are young with these services. Now, let me take you through our user journey. The first part is the pre-service where we create awareness for her. The second part is the onboarding where we perform medical KYC. The third part is the homepage where you have access to the features of our app. The fourth part are IoT devices you can link to the app. And the fourth part also is the telemedicine service. Now, let me hand over to talk about the market analysis.
Now, taking a market analysis of this problem, we've come to know through the Nigerian Heart Foundation that 76 million Nigerians live hypertension. And it has been stated that 50% of this population are young Nigerians between the age of 20 of age. And about 1.2 trillion naira is spent every year to manage these conditions. Now, our target market, even though there is no statistical variables available to cover the total chronic illnesses available in Nigeria, we have been able to streamline it to what hypertension has to offer. And the total available market for hypertension is 38 million young Nigerians, of which the serviceable available market we can offer our services to is 19 million. And those are those that are not compliant to their medications. And now the market which are targeting directly makes up 5% of that, which is just 950,000 people. Now we did a sub-market validation survey among Nigerian youths, and we're able to understand that 5.3% and 63.5% of them do not use their medication, do not comply to their medication use due to forgetfulness. And 74.1% of them are willing to take up this application, they are willing to take up this IoT devices to be able to comply themselves to their drug use. Now, talking about our business model, we aim to leverage B2B, B2C, B2C, and B2C, and B2B, B2C models, whereby we leverage sales of medication compliance devices, advertisement, and our telemedicine subscription models, which is based on tiers. Talking about our competitive market, we have MDOC as a competitor and well-being. However, we stand unique in personalized user management and affordability. Now, meet my team. We have a complete team full of field experts and technical service providers that are able to develop our MVP. Now, medicine, taking control of your health.
I promise you, they have this time. Alright, judges.
The problem was clear to me, the solution. I just want some clarification on the IoT. Is it a wearable device? Like you can answer me, is it a wearable device, the IoT?
A wearable device is a carryable device. Yes, you can, as small as being a keyboard or something that can actually move it around.
So why do you need it when you already have an app that sends you notification?
Most people can play application on their phones, but does not mean they will actually use this drug. Okay. Thank you.
Okay. All right, thank you very much. I like the fact that you had a demo on the phone. And did you do that in 3 days? No, just take note of the question. All right. And now, looking at your program, you mentioned that you're trying to help remind people who are supposed to be on medication to take their medication. And you mentioned forgetfulness as being one of the major causes. I've been in a medical session, with some group of physiotherapists, and their interest was on people who deliberately avoid taking medication. Take, for example, somebody who is on a rehabilitation program, and this particular person deliberately doesn't want to take the medication. And doctors will give him the medication and he will fling it away, or tell them he has taken it and still there's no progress. Depression patients may have that problem. So does your solution, apart from those who mistakenly forget to take it, does it take care of those who deliberately say they have taken it or haven't taken it? Okay. Now, when someone does not take the medication, I've looked at the registration form on the web page here, on the app. It does not collect details of your medical doctor or whoever is in charge of you, your carer. Now, shouldn't that person be alerted? Okay, and if that's the case, then is that a mistake on the app, or is that something that you feel there is no need for? All right. So last question, which may be the previous question. The IoT device, I saw it very quickly. Maybe we can slide back to it. It was like that container there. Is that what you wish it to look like, or is that a practical design? Is that something you believe will house the battery and everything it needs? Thank you.
Now your box. What does it track? Open and close? Oh, okay, so you understand it. So is it open and close? Or is there a way that you would track that the person actually puts the drug in the mouth? Right, so that's 1. 2, are you expecting from the app that there will be any data entry, or it's going to be automated by itself? Thirdly, how do you acquire customers? Right, and finally, who's paying for this?
Beautiful presentation, because this is that you actually solved it. It is a real challenge. Even me sometimes, when my body is a little bit okay, I forget to take the mini drugs because I'm already feeling better small. So I really appreciate this solution. So however, is it sufficient? Is it going to be free or paid subscription? Thank you.
Okay, I'll start with the question on when we did these designs and everything. The designs for the application and device were done within 6 hours. We have our graphic product design on the team, and we spent through the night without sleeping to design prepare everything for use today. As regards the IoT device, is that what it will look like? We designed this basically for a prototype. We hope to build on it. We sincerely hope to build on it to make sure that it's wearable, it is carryable, easy to use, and even if you forget it, you can easily find it without having issues. Now, as to how do we acquire our customers? We plan to partner with hospitals, medical doctors of these consultants specifically that treat patients with chronic illnesses, and also pharmacies where patients actually go to buy medications. So those are those we plan to partner with in order to acquire our customers. We also hope to leverage on social media ads, community gatekeepers, and school campaigns for youth in the society.
Yeah, so as regards the deliberate medication dodging, we actually took that feature. We are supposed to create 3 users in the app. So there will be a user that's the main patient of the chronic illness, and there will be the family member or caregiver also have an account that can track the progress of that, and the healthcare provider. But then again, we realize that we are targeting young people, and we know, because we are young people, we do not like to be monitored. So if we put that as a feature, people might not be willing to apply for it. So that's why we excluded it, but it is definitely something that we thought about, and we will definitely add that. So as regards the data entry, yes, on the app there will be some parts where you have to input manually some data. For example, your blood glucose level or your weight. So yes, there will be data entry. The customer acquisition, like you already explained, we're going to partner with pharmacies, healthcare providers, and other organizations. Now, if it's going to be free or paid, yes, the app is going to be free. We use the app as a upselling method. So if you have the app, if we advertise the IoT device to you, so if you have the IoT device, you can actually achieve more functionality. So yes, the app will be free, but we also need to employ advertisements to generate?
Apart from the app being free, there is telemedicine services for patients that actually need to go to. One thing we've also noticed is that patients go to chronic patients, illness patients go to the hospital regularly. And most times when they get to the hospital, the question is, have you been to the drug? Is there any changes? Hope there is no issue. And they give them the same drug over and over again. But one thing we are going to try to reduce is, since we are going to be monitoring their vitals, we are going to be able to monitor if they will actually need to consistently go to the hospital over and over again, therefore reducing frequent hospital visits. And in case of when there's a need or a change in their metrics, then we can offer telemedicine services for them to actually ascertain if there's a need to actually go to the hospital for physical visit.
Really?
Yeah, one more thing I want to add concerning how to encourage users to continue using the app. Like we all know, we are young people, we like, for instance, stay engaged in social media, stuff like that. But we are introducing something like a game section to the app rather. So let's say when you play, when you keep track of your health or your health, let's say blood pressure, you get incentives like, let's say, coins and stuff like that. So like maybe when you reach a particular level and then maybe airtime and stuff like that, that would encourage the users. So like that's something that can encourage users to continue using the app.
Remember, the app is to be free.
Yes.
So who's paying for the airtime?
We generate revenue from the sale of our IoT device.
Hardware.
We are not considering it
We mentioned the advertisement in the app.
So your IoT device, what is it measuring? Open and close or build to mouth?
Okay, it is measuring two things. Number one, the open and close. Number two, we will have weight sensors inside that's going to be measuring the metrics of each drug that's going to be used. Now, we thought about it. We thought about a way to actually make it usable. It's not just to avoid just opening and closing the container. And we thought of, okay, we can have a weight sensor that can measure the total amount of drugs inside that particular container. And if you take out one, it reduces the weight and syncs with your application that a particular drug has been taken. Although we cannot be able to cover the back of if they're using the drug.
Just as feedback, open and close and weight sensor. Right? I mean, you have patients, you all know, you take the drug and use it on your food. Right? So your true test of adherence is built on that. Right? Just as feedback.
Thank you very much. Please round of applause for Team Health Innovate. Okay, so as a reminder to the participants, you have 5 minutes to make your pitch. You can come on. You have 5 minutes to make your pitch. When you have 3 minutes more, the timekeeper will show you the time card saying 3. When you have a minute more, the timekeeper will show you the time card saying 1. And once your time is up, you're going to hear an alarm at which you must stop talking whenever you stop, right? Good. After that, the judges who will be collating their questions through your presentation will now read out their questions to you. You take notes of the questions and you will answer all of them after they finish asking. And you will do that in 5 minutes as well. So your time starts whenever you start. So you can take some time to compose yourself. Once you start speaking, your time will begin. Thank you so much.
Good morning, everyone. We are Team Health Impulse, and our project is focused on solving SDG3, which is good health and well-being. Labake is a 19-year-old from the University of Designathon. She lives in Okeado, Oyo State. She is sexually active, and just like every other young people, she enjoys sex and does not want to have a unwanted pregnancy at the same time or contract any new STIs. However, Labake faces some challenges. Due to the fear of being stigmatized, the fear of privacy, confidentiality. So as a result of that, she does not have access to these reproductive and sexual health products. Unfortunately, she became pregnant and was forced to drop out of school. Whether we like it or not, youths would always, or young people most especially, would not try their ways to access. So in fact, statistics shows us that 250 million of young people have sex daily. 250 million, they have sex daily. And WHO also shows us that, reported that ages of 15 to 24 of young people, 50% of ages 15 to 24 young people, they contract new STIs. It also reported that ages 15 to 19, people within the ages 15 to 19, they have unwanted pregnancy. Ages 15 to 19, 3 million undergo unsafe abortions. So the question remains, how might we solve or how might we improve the access to these sexual and reproductive products? Michael will put you through. Thank you.
Our solution involves the creation of Adam and Eve. So Adam and Eve is not of religious beliefs, but Adam and Eve is a comprehensive sexual and health products package that our consumers are able to order online. People that are living in urban communities are able to get these products through a WhatsApp chat box. Now these WhatsApp chat box, they are able to list out their items according to their preferences, and they are able to get it online delivered to them at their own convenience. For our consumers in rural communities such as Erua in Oyo State, they are able to reach out to their local community health pharmacy in order to get this product. Now, the benefit of this product is that it increases privacy and confidentiality of our consumers, and also reduces the stigmatization that our consumers are known to be associated with since they are participating in sexual activities. Now, Addition would continue to put you through.
Yes, how do we achieve this? Firstly, we get the components of our Adam and Eve self-care kits from our partner companies at a cheaper price. Then we package them, supply them to our partner pharmacies. A young man, who needs our self-care kits, who stays in Ibadan here, all what he needs to do is to pick up his phone, contact us through our WhatsApp chat box, and then we get the products delivered to his doorstep. But what about Alake, who is in a rural community in Oyo State? All what Alake needs to do is to walk up to a nearby chemist and get our products. However, a question pops up here. How did Alake and Aremu get to know about our products? Alake gets to know about our products through a community outreach we carried out at our local environment. Why Aremu gets to know about our products through an advert he sees on his social media platform and posters seen around this area. What are the components of our Adam and Eve self-care kits? The Adam parts for the young males include the male condoms, the lubricants, and beard oils. While for the Eve part, it includes the female condoms, tampons, pregnancy test kits. Michael, tell them.
We're talking about when we were designing our project, we found out special competitors during our market strategy. And some of the competitors include Whisper, Nepali, Maristops, and Hesed. However, what made us special was our privacy, our specificity of product, the user experience, the better user experience, a mixed focus market system, and we are less expensive. Labake, with many thousands and millions of young people, due to the fact that.
Thank you very much. Time is up. Give a round of applause to Tinka Impulse. Alright, so I'm sure our judges have questions.
Thank you.
The questions we collated says amongst. Alright.
Okay, thank you for the presentation. And I must actually commend you. This is actually a very big problem. And people operating in the adolescent space, sexual and reproductive space, they really appreciate this solution. As a matter of fact, I've also played briefly in this sector before, so I understand the problem. But your solution is still, okay, like I'm a little bit skeptical, because you are not actually solving the problem, which is anonymity, discretion. And you said something about the people living in rural areas, that they need to reach out to a representative of, like, someone in the community. It's usually like a very small community. So when I reach out to you, you already know that, oh, it is you, okay, fine. So something like that. So I don't know, you need to rethink that. So, but I have issues on your competitors. And I think your greatest competitors are actually Global and Innovated. You know, on Global, you can actually order for all this kind of thing. Who use Global here? Do you use Global? Have you started about Global? Do you know they actually have all this on their store? Okay, you don't know, then you need to research. So one thing is, I would probably prefer to even order from Global, because when the Global guy comes to deliver something to me, everybody will think it's food, something like that. So yeah, thank you.
I like that you guys actually saw, you've been able to recognize that problem and create solution for it. However, I have a bit of something about the name of your kids. You know, it actually looks discriminated sometimes, especially the fact that you call it Adam and Eve. Some people might find it like, especially religious people, some people might be like, why should I use something like Adam and Eve? I feel you should name it something that, because you will be using a product like that, you feel like God is watching you like Adam and Eve there. Like, you might not be able to want to engage in that sex. You understand what I'm trying to talk about? So I feel it shouldn't be named from something like from Bible or from I think it should just be a neutral name that will make people feel like, okay, what I'm doing is not a sin per se. I don't know if you get it. Maybe Romeo and Juliet, you understand that kind of thing. But no Adam and Eve. That Adam and Eve is there. Even some Muslims might feel like it's a Christian thing. So you have to be very careful about the name. Yeah, thank you.
Yes, not only that, I think like she said, these are religious, it's from the Bible, isn't it? And also Adam is also a prophet in Islam, so that means that it's more like making it a religious name for that. But all the same, we know you are trying to create a solution to a problem of indiscriminate and, people not being able to come forward for sexual, transmitted diseases treatment or so. But here is my take. You mentioned door delivery for some people, and you mentioned going to the nearby pharmacy. And like it was pointed out, Global, is it Global now? Global is hate food as well, junior food. They have something like this. The reason is that people can easily disguise that, I ordered for chicken and chips, whereas it's chicken and chips plus one of those other things. But in your own case, they already know that this is Adam and Eve. So once they see the person comes to your house on Monday or Tuesday, they'll say, you have a special package. So maybe you need to make it broad to prevent that ease of detection. Then also, I'm looking at, you have painted a picture of a few products. You said condoms, some other things, right? But I believe that somebody trying to treat some STIs, for example, gonorrhea and co, will also order for their drugs, right? Now, it gets to a point where we need to deal with drug control to prevent drug abuse. Now, in that case, in all of this tech that you are deploying, can you mention what you are putting in place to monitor abuse of drugs? So that at the end of the day, you are not enhancing drug abuse in a case where somebody can sit at the back end and order for the same drug 3 times and you will be supplying. At the end of the day, it's been told that, this particular person has used so-so pills 20 times in a day or in a month. And then your solution will be liable for that. Yes. So please, I want you to address that.
Thank you very much for this.
So sometimes the best technology is no technology. Right? So what happened to the simple phone call? Simple phone call. That's the most anonymous way to engage with anybody. So that's one. 2, I'm not really sure that I'm seeing any innovation. Right? As a whole. I'm trying to pinpoint what's new, what's different. So maybe you might want to highlight that, again, because if it's ordering products, any of those people that you have, listed out, you can order stuff, plus other, set of people. So, what's the innovation, really? The other thing I should also point out is, and again, whether this was there or not, you begin to see a rise in what you call test at home kits. Right. Maybe that might be your innovation. I don't know, but really for me, I'm really trying to find out. It's a problem. It's an issue, but will this move the needle? I don't know. Thank you.
Thank you very much, sir. Well, our innovation, what we bring specifically different is on the issue of privacy. Well, for most advanced, the current type of businesses, the current kind of companies who are offering similar products, there's a model where we form called KYC. And in most cases, we have issues with data theft and data, people selling our data. So we are trying to bring in a solution where you communicate to us through your WhatsApp and we do not need to know your name. We don't have to know your name.
You cannot deliver it to me without knowing my name and my address and my phone number.
I will know your address.
So if you now get there, what you now say?
There's a code we generate, just like a for-chance system. We have a for-chance system where, like it's a website, an anonymous website where people use.
When you get to the house, let's say you get to Indie Hall.
Yes.
Who will you give the drug to?
He has communicated with us. The delivery man would communicate while he chats with us over WhatsApp, on WhatsApp. We communicate and logistic people deal with the delivery down to him. So we do not know who is ordering. We make use of the code. In as much as the code matches with whosoever is going to do it over there, I think we've solved the issue of privacy.
What if the delivery mind is my brother's friend, my friend's brother?
Well, we believe that when we consider it in a larger scope, privacy itself has been solved to some extent in a larger scope.
Anyway, you are giving the phone number to the delivery man. Yes. And the delivery man will call the number.
Yes.
Okay. That's another data, isn't it? Just like me.
Also, we consider the issue of STIs and drugs. But we believe that there are regulations regarding the use of antibiotics. We do not want to increase the illegal use of antibiotics, which contributes to AMR. That's why we are kind of a bit specific on our products. So lubricant, self-test kits, and similar products.
So it doesn't address STIs. It prevents STIs.
It prevents STI, but doesn't address STI.
And the main reason why we used Adam and Eve was to just to separate that, okay, we are going to have a male self-care kit and a female self-care kit. So that's the best way we can think of, okay, Adam and Eve, just to separate. In case they want to get it. Jack and Rose.
Okay, and for the door delivery, it would be in urban areas such as Ibadan, it would be from, pharmacies, retail pharmacies. Just like Metros now, if you want to get something and it has to be anonymous, it will be coming from those retail pharmacies. And for the drug abuse,
Yes.
Sorry, I think there's a question here. On sustainability, right? We know that Hey Food, Jumia Food, and Glovo, they rely on people using them heavily. So based on your statistics, through 250 million globally, in your state, do you have an idea what the number of people would be? To look at the markets available, the market size. And of course, the profitability, because how much will you charge to deliver, for instance, let's say like 300 naira per delivery of it.
So for our products, we have a list. So it will be tailored according to their needs. Okay, I want the blade condom parts. So the price will be according to their choices.
I thought you said kit. How much is a kit? Like you have a kit. How much is kit?
We have an array of products.
How much is kit for?
Are you selling an individual product or you are selling a kit?
We are selling a kit, and this kit will entail all the preferences.
Good. So I can only order for kits, right?
Yes.
So which means that if I just need, let's say, a PT stripe, I can't order for just that.
You can't order for just that.
No, you can't. You said you can't. You can't or you can't?
Yes, we have different packages, sir.
There's different question. You can or you can't. You can't.
But the delivery price will be fixed.
Depending on the person.
Thank you so much. If you had the opportunity to be in this Designathon, what SDG, at least that you've seen presented so far, we've seen quality education, we've seen zero hunger, we've seen good health and well-being. What SDG amongst those three do you think that you'll be interested in looking for a problem to solve, and how do you think you can, solve that problem? It doesn't have to be anything elaborate, of course, not like this, but just a thought. So who wants to volunteer? We don't do things small around here. You want to volunteer? All right. So please give her a round of applause. Please introduce yourself. Don't worry, I'll tell you the questions. Introduce yourself.
My name is Runta Chinema. I'm a medical student. I'm a 300 level medical student from the University of Ibadan.
Nice to meet you, Chidima. All right, so since you've been here, what have you learned? What is something that is new to you that you didn't know before?
I learned reaching out better to the target audience.
Okay.
Yeah, especially for the medicine people. When Dr. Simha was asking, who are you going to? Who is going to give you the money? Yes. So putting plans in place to reach out to entire audience, because these people can be in communities that you don't know. So it's better for you to reach out to the communities so that you can reach out to them. That way, because they have established trust in the communities, and you come to someone that they trust, because Nigerians mostly deal with people that they trust, they will not trust you.
So have you ever been involved in a Designathon before?
Yes.
You have? Right. Did you tackle SDGs like this?
The Designathon I was part of was just good health and well-being.
It was just good health and well-being. Okay. So seeing what they've done here today, do you think that you would want to be involved in preferring solutions for zero hunger per se, or quality education? And can you just on the spot just think of one innovative way that you can prefer a solution to any of the problems we are facing in those sectors?
But just this two, or also health.
If you give me health, I know you're going to give me the solution you did at your Designathon. I need something new, fresh, and innovative on the spot.
Okay. I'm actually okay. First of all, considering, we've been hearing telemedicine services. Telemedicine services now are hot among a lot of telemedicine companies coming up. But most times, telemedicine companies don't reach people without smartphones, and people without smartphones, and then people that only buy social media data, because not everyone is financially able to buy normal data. So most people only buy social media data. So I was thinking, what if it is possible for the first category of people, as people that don't own smartphones? You know, the normal MTN credits that we buy as on paper. What if it is possible for them to purchase those credit papers, and then when they process the credit papers, they're able to like credit their maybe wallet. Maybe the company sends a message to them, okay, maybe let's say your company A wallet has credited this, and then there's a fixed price for consultation. Then when they credit their wallet, they can call the toll-free number. So when they call the toll-free number, then they talk to a doctor on the other end. It's going to be more like a customer service kind of situation, where a customer service like the automatic generator response part actually redirects them to a doctor on the other end, just like a customer service. Then they're able to tell the doctor what is wrong with them and everything. And in the case that the person doesn't want to have a normal call, and they don't want the person to hear their voice or anything, they can go to the WhatsApp chat box, where there's a sign-up process, like an automatic sign-up process, more like a column response kind of thing, where they can pick an option, and then based on the option they pick, the WhatsApp chat box gives them the response. So that's what I was thinking about, and I guess I hope that solves the problem.
Chidima has come here and she has pitched. As in, all that remains that she should have brought her pitch deck, but she just pitched to us an entire idea. If you have money burning a hole in your pocket, you are looking for where to invest, you know who to meet after this program. I think that she's deserving of our gift. I wasn't expecting such an elaborate answer, but I really do think that she's deserving of our gift. Yusuf, it's Chidima's gift there. So you're going to get a gift from one of our organizers. Thank you so much for responding to us. Thank you. Maybe back to you. Okay. When you see things that are solving problems for you, making things easier for you, there was a whole process that went behind it. People did this on much larger scales. They did community surveys to find out what people need, what their problems were. And they had to sit down and think. These people had only 72 hours. We spent months, years, creating solutions that will last and stand the test of time, just so that people in our society can have easy access to basic amenities. And so it's a very wonderful thing that we're doing here. And I encourage everybody, if you've not already started thinking about design thinking, this is the time to think. So put on your thinking caps and begin to think. Right? So judges, are we ready to admit the next set of pitches?
Yes.
All right. So our next 3 pitch presentations are going to be covering SDG 3, good health and well-being, SDG 4, quality education, and the only SDG that we haven't seen represented here yet, SDG 16, peace and political stability.
If the problem is getting people that are out of school engaged, I don't think there's anything new that you have shared that I have not heard 1,000 times, or that maybe she has not done 2,000 times, across board. What's different?
Yeah, President Speaker, thank you for the presentation. Because I operate in this space, so I can relate to a large extent that what you're trying to do is actually very important. Because at the moment we have, highest number of youth unemployment in the world, Nigeria. So yeah, and one way I think we can actually solve this problem is through strategic scaling, right? So yeah, that's actually why I'm actually relating with you. However, I have problem with your strategy and execution. Looking at your user persona, you are talking about Raimat. Okay, Raimat orgs, and then they're trying to take Raimat off the street to come and learn the skill. Now, in my experience, one thing I've learned is that now, Rival actually helps so that she can feed, right? Herself and her family. Now you're taking her off the streets. Who's going to feed her and her family? Yeah, of course, you are trying to say, okay, yeah, come and learn a skill, but of course, she'll probably not start any from that skill for like a year or even 2 years sometimes, right? So in the meantime, who is funding her, who is giving her food, who is doing all that? So that's one question. Organized trainings, I know how long, even mentorship after them, I know how rigorous it can be for you to actually be able to get something meaningful and practical out of it. So now, if your training is, let's say, okay, running for 3 months, how do you ensure completion rate? Because completion rate is actually one of the biggest projects in the education sector right now, let me tell you. Because a lot of people, and now they're making it free, they're not paying, right? So how do you want to ensure that commitment? They are not, okay, the Yorubas will say that, like the medicine you don't pay for, it's just put it by the fireplace, right? So how do you want to ensure completion rate? So, and then, of course, I can see the arrays of organizations you listed, like Planetary and others. Have you actually reached out to these people to know their capacity? You know, to take these people that you want to, like, you know, place with them. And then my final question, who pays? Who pays? Because, see, it's very sweet as you are presenting it like this. By the time you get to the market, that's where you realize that, okay, it's actually very, fundraising is logic, right? So I can see you said crowdfunding, you know, grants and all that, but I don't know, you need more practical ways at funding it. Thank you.
Thank you so much. That's a beautiful presentation. And I really want you to take note of those things that he has said. Well, you know, a lot of people do reach out to us that they have people in their organization. You know, most of the time, they don't reach out for us. Most of the time, they don't reach out for us before they even set up the project. Like you guys now, they will set it up, they will get people to sign up, everything by the go big. They will now come and now say that, please, we want to attach 3 people to your organization. I will not be wondering that how it is their dream. Our benefit is that it will promote us. You put our name in the beginning. I'll be like, and how does that put money on my destiny? I'm telling you, for me, most of the time, we make impact, but if it's not making money, it's not making sense. So, if most of all these things, you know, like you said, it looks good on paper, once you start reaching out to those organizations, you need to see how many proposals are you will drop. Because these people too, they want to make profit.
So it's not totally free, but it's something they can afford. We are looking at the affordability of these things as well. And the parents as well, seeking consent from the parents and for them to pay off.
For what Raina will feed on if she is taking off the streets to learn these skills, we thought about it and we said that while they are learning this skill, they are stipends because they are also working. So there are some skills that they are learning and they are also having some form of stipend being given to them to be able to sustain them a little. And we are going to explain to their parents too that the skill the child or the youth is learning is not something that will generate money immediately, but they should see it as a form of investment that will that have potentials and will give stories of successful people to the parents so that they will be able to give the child. Because we discovered that financial constraints, not financial constraints per se to go to school, but in the family, the parents see that these children have some form of responsibility to provide for the family, so they are sending them to go and sell. It's not as if the money that they are selling is for themselves, it's for the parents. So, but we are going to, when we discuss this with the parents, we believe that they will be able to give us a chance to lead this youth to learn skill?
Sorry, can I see? Okay. Sorry. Like what you just said now. Parents will not allow their children who will now be selling for them to make money. You don't understand. Some people, if they don't sell in a day, if they don't kill in a day, that money they will not eat, And you are not saying that who will not be giving the stipend, because not all organizations, even they will expect you to pay for the skill that they are coming to learn. So who will be paying them money while they go away? Because when you want to say that you are not working again, that means that you must be giving that parent something, you must be providing for that family. So you must have something. Most parents will not allow. Let me tell you something. Most of all these dropouts that you are seeing, that they are selling on the streets, they need that money to survive every day. In fact, every day. As we are speaking right now, some of them are on the street selling.
Thank you very much for the insights. We'll go back and work on it to find out a better way of.
And you must make it not too attractive so that other parents will not tell their children to also be on the street so that they can get the benefit.
You may leave or you may decide to sit in the audience. Thank you. So that was Team FIFA with Project TAB. Team FIFA, FIFA. Yes, ma'am.
Good afternoon, judges. Good afternoon, sirs and lads. Meet today. Today is a 20-year-old student whose mother has been struggling to make sure he breaks free from substance abuse. Today is someone who takes excessive alcohol and also smokes ego. Therefore, he has been having failure in decline in academic performance as well as relationships. Today is just one person out of 8.1 million young people who abuse substances daily. Today could be your brother. Today could be your son. Today could be somebody sitting next to you. People like me today would have loved to help today. However, a simple call at Akron Medical Center in Lagos shows that we need at least 250,000 naira to access rehabilitation services. How many people can afford those kind of services? So therefore, our team is there to help people like today. I am Kadibite Mariam. This is Paul Oluwaneyi. This is Howard Hadibisi, and this is Samuel Sampson. We have to break through. So therefore, how might we reduce substance abuse among young people aged 15 to 13 in Nigeria, southwest Nigeria?
The answer to that question is Break Free. Break Free is a mobile solution that helps people who are having issues with substance abuse. Right. Break Free comes with a model of tagged 10P. This stands for tracking, E for education, behavioral therapy, M for motivation, P for peer-to-peer community, and G for gamification. Here is the user journey map. It starts with today's mom or the caregiver taking today to a psychotherapist or to a clinician. The clinician, after his session with Today, recommends the Break Free app. Today is made to download the app, signs up, select a recovery plan based upon the recommendation of the clinician, after which he is able to track his progress, receives education behavioral therapy, also receives motivation reminders on his home screen on a regular basis. Also, there is a gamification feature and online peer-to-peer community on the platform. Now, evidence has shown us that in the United States, there is evidence that the use of mobile applications technology has shown to help those who suffer from substance use disorders.
Here is the journey through our application, Break Free. First, a user gets to download the application from Play Store or any mobile app download platform, and then they go through the onboarding process. Then afterwards, they get to go to the sign-up screen. So from the sign-up screen, after they have a screening screen. A consultant is recommending our platform to somebody, to a patient. So a patient has to go through the screening platform based on the recovery plan that has been recommended by the consultant. Once they get to the home page, they get to see all the available features that we have for them. Go back, please. All the available features that we have for them. And this is an example for someone trying to set a gradual reduction goal for, let's say, substance abuse for, let's say, alcohol, for example, and then they get to see a success. Now we have a tracking feature. Users get to track sobriety days, they get to track relapse days, they get to track their
medication schedule period and all of those things. We have a gamification feature in two phases. The first is streak-based method and the second is the leaderboard-based method. The leaderboard-based method gets data from the streaks, monthly streaks that have been accrued by a particular user, and then it's transferred to the leaderboard. We have a peer-to-peer community platform where users get interact with one another, and then we have experts on this platform to monitor conversations. As a result of this is an important part also where we have education facilities, videos, articles, and there's a behavioral therapy part where it's going to like seek conversations with therapists and counselors. There's a motivation. We need to like give these people positive nudge and motivation in order to do what they have to do.
Breakthrough has a total market of about 8.3 million who are drug users and fall between the age of 16 to 30 years Nigerians. Our total serviceable market is about 0.9 million people who are tertiary institution students and are no drug users, while our target market is about 200,000 students who are in southwest Nigeria. At UCH, which is a federal medical center, it's 3,000 naira, 3,050 naira, which means that for anybody that is willing to go there, then if we are providing something that you are able to access from your home, that you don't need to pay for transport, you can easily pay for that. Then, on how did we speak with people? Yes, we had a survey yesterday, and that was among students of the University of Ibadan, and of course students from our various campuses, and we had...
There are small people.
Yes, no, primarily we had about 60 people that responded, and out of that, about 60 people, about 8.3% of them are people that abuse different substances, and for them, they are all willing to get some level of help, which is why we decided to start with the campuses. Thank you.
Okay, thank you very much for the questions. You asked a question about what will be the gamification entry. Basically, our plan is we consider stuff like people actually want to come on this platform. That's why we are coming from the perspective that it is the caregiver that is responsible for the person. So therefore, we have a back interface so that the parent is able to monitor what the child is doing as well, and the physician is also able to monitor what the child is doing. So basically what we are doing is an assisted platform. It is like a continuum of care. Normally, we cannot eliminate people seeking psychiatric doctors. It is not possible. Because even the WHO also recommends that there should be a point of contact with people to do the risk assessment and stuff like that. So therefore, the gamification aspect of this is just that by the time we are providing psycho-education and the behavioral aspect of it, we have stuff like having Quizlet, having flashcards, whereby they are able to answer questions based on the articles that we provided for them. So that would be like a form of a leaderboard system that how many questions are you able to answer? And then have you considered the working center? Yes, we did. We are actually going to leverage youth-friendly centers, just like we have youth-friendly centers for HIV/AIDS patients. We can also do the same. The peer-to-peer intervention is something that can also be done, physically apart from the online platform. And if you check the slides that we show about how the apps looks like, we show the place whereby we are able to show what is happening in the peer-to-peer medium. It looks like just exactly like the WhatsApp medium, whereby you are able to meet people on the platform. It can be anonymous and you can decide to meet the person physically. And all of this as well is still also based on the caregiver monitoring. That's why we have the back interface. And then the fact that it's the caregiver that is responsible for the person, that's the payment mechanism. We do not need the person needing to help themselves to pay for it. Because we know normally that they might not be willing to at that point in time. So I think you've been able to answer most of. So thank you very much, answers.
Thank you very much, Team Breakthrough, for your pitch presentation. Thank you. Please, another round of applause for them. Distinguished guests, we are on to our final pitch presentation for today. And fortunately, because it was by balance, we don't know how it happened this way.
It is our only team that is presenting a solution to a problem under SDG 16, peace and political stability. They are also our only 3-man team, as one of their participants actually dropped out last minute and did not show up for the event. So everything that they've worked on for this past 72 hours, they've done as a 3-man team, and they are ready to show you. Please, ladies and gentlemen, welcome Team Safe City. Okay.
Hello. Sorry, can I suggest something before they start? Can all of them come in now, since it's the last thing?
Can all of them come in?
All of the teams, yes. Thank you. All the ones that are doing, they just stay. They don't want to be seeing them. Oh, okay,
Good day, my name is Mustafa Musliuddin. I am.
I'm so sorry. It's only fair. We told the other teams about the time rules, just so that you are aware. You have 3 minutes. You have a time card that will show you when you have 3 minutes left. A time card that will show you when you have 1 minute left. And then when you hear the alarm at the end of 5 minutes, you have to stop talking no matter where you are, right? And then the judges are going to, they're already collecting the questions while you're presenting. They will tell you all of their questions, and you just note them down, and you have 5 minutes to respond to the judges' questions. I'll be fine. All right, thank you so much.
Yeah, good day. My name is Mustafa Musliuddin.
I am Akintola Akindele, and we are here to tell you the best speech you hear today.
Count with me. 1, 2, 3, 4, 5, 6. Over 68,000 cases have been reported on offences against property. This actually been burglary, robbery, and the likes. This case has been actually a nightmare for us, every citizen in the various country, and you know, we will keep on going this way, whereby we all have to avoid, you know, try to be in risk, danger, and all these things. Such a case is that of Alabi. Alabi is a victim of one robbery incident that caused his left leg and actually made him an amputee. Yes, what did Alabi want? Alabi actually want an effective platform that enable users to give information about crime happening in their location. These are problems we've actually identified as a result of what occurred to Alabi. The first one is lack of effective and convenient ways for citizens to actually report crime incidents and receive feedback and support from authorities and other users. Also, lack of timely, reliable, and accessible information about crime incidents and trades in different locations and communities. Also, lack of trust, collaboration, communication, and coordination among citizens, local authority, and businesses. Now, what are the solution? We, as a solution-oriented person, we've tried to create a Safe City mobile app. This app enables users to report and track crime incidents in their neighborhood. It also provides users with real-time alert, safety education, and community support to prevent and respond to crime. Also, uses latest geolocation, ground sources to collect, verify, and analyze crime data from use and public sources. It also generates, analyze, and share data and insights about crime incidents and trade with users, local authorities, and businesses to improve safety awareness and decision making. How does this work?
How does our app allow users to register, log in, and specify or be anonymous? Our app allows users to report crime incidents based on their locations. Our app allows users to track the progress of the report of the crime, and then to help local authorities, businesses based on their location. Then, based on those features, the information that the user submitted, we are able to generate user this time alert, safety tips, and community network what do you mean by community network? That is ability in take zone where they can run things in terms of data. Our app now allows us to generate and share data for business to improve safety, networking, and others. So our target leaders are the citizens of Nigeria and local authorities. Our competitors are social media platforms, channels, TV apps, rallies, TIDA, change organization, and amenities.
Okay, what differentiates us from other apps? Number one, we make use of innovative and unique value proposition that address social problems and market gap. Number two, we make use of user-friendly and accessible services that allow anybody, whether you are tech literate or not, to make use of the app. Then we focus on local crime reports tracking. Number two, we give real-time alerts, safety education, and community support to our users. And number three, we give room for users to be anonymous. You don't need to enter your space to report crime. And number four, it enables users to define safe zone areas and receive notification when their loved ones enter a safe zone. Okay, how do we create awareness for our app? Online medium, word of mouth, partnership. What is our business model? In-app advertisement, data monetization, sponsorship. Adaptability. We don't want our app to just work alone and work with other apps. We have wearable devices, social media platforms, smart homes, security cameras. And what is our user retention method? Loyalty, rewards, gamification, socialization, safety education. We are peacekeeper and we are here to make our city safe. Thank you. We will ensure that everyone live in a safe city. Thank you.
Safe city. Thank you so much for the presentation. Of course, it's a nice idea, but I don't know. It's actually probably one of those ideas that's very nice and it can be very tough when it comes to implementation. Why? Because the bulk part of the implementation, like you don't even have the power to influence that because it's the government, the security. So after people have reported incidents, they've done all that, and the local law enforcement says they are not coming. What do you want to do? There's nothing you want to do. And that's why I'm actually interested in what you are doing differently, that other competitors are not doing in terms of relationship with law enforcement. Are you giving law enforcement additional resources to be able to respond to reports that comes through your app? So like that. And then I also have issues with your business model. I'm saying data monetization. And I hope you actually know about the fact that Nigeria now has a new data protection field. So you need to be very careful as regards to that. And then health is also another thing. And when it comes to security, it's actually a very important and touchy and sensitive issue. That even saying that you're making money through health, at a point, you probably want to risk being sensational. So that people can, probably report stuff and they can consider they can make money. So these are actually the issues I have. Thank you. Nice presentation.
Yes, thank you very much. This particular sort of solution, I've been in one hackathon like that where it was presented. And of course, it's always a great idea to try to give people real-time information of crime in the areas. Particularly if you want to move into a neighborhood, you want to rent it. You need to know what time to not go out, what time is not safe, and what kind of crimes to be ready for. But then the question is your source of crime data, okay? You mentioned that people that have the app can report crime. Does that automatically add to the possible crime in that area, or does it need to go through a verification process where it must be corroborated by somebody in the law enforcement agency, so that I don't deliberately spoil the record of a particular neighborhood because they are my competitors in the real estate world? Then secondly, you mentioned we have wearable devices, we have smart cameras, we have this, we have that. Who are the we that have it? Because you're here to present on your design, you've talked about your app. Now you're talking about we have wearable devices, but you've not talked about how you're going to build that or what it's going to look like. You showed a smartwatch. I want to think that's an iPhone smartwatch, but I don't know if it's something that you're also building for your solution. And let's talk about what you're doing or what you're bringing, not what you wish to do. Because if you're going to say we have smart cameras, I'm going to ask you, how are you going to run an AI computer vision solution that can detect crime, or what is your smart camera doing? Or are you not relying on the cameras of eyewitnesses? So let's keep it within the scope of what you're bringing to the table. Thank you.
So the police has rescued me. Have you heard about it?
Yes.
What's different? Because you didn't put it in your computer slide.
And police is the owner of that.
And police is the chief security man, right? I'm sure most of us have not downloaded that app set, right? So what would now make us download this? I think that's really the major thing. Is this, what kind of revenue are you looking at? How do you sustain this? Do you expect that people are going to be checking the app every day? Because you need eyeballs if you're going to do ads, right? And they're going to be engaged. Or I'm just trying to fit how, you know. Oh, you understand already? Okay. All right, thank you.
Okay, so when you talk about business model, data monetization, yes, we are aware that the president who just signed the Data Protection Act. So now when we are talking about data monetization, we are not talking about the personal data of our users. We are talking about crime data reported on our app, and this is what we are trying to monetize. And talking about the question of this also wearable devices and all, we are not saying we have this app. We are talking about adaptability and integration of our app and our software. We are trying to partner with wearable devices company, security service company, smart home devices company, so that users can integrate our app, connect it with their wearable devices. So you don't have to like check your phone all the time to get alerts. If you are not with your phone and you have your wearable devices, you get the alerts. If you are told your smart devices are Alexa and all, you'll be able to give notification like, oh, so alert is up on this app, you get it. Then CCTV camera company will be able to use this to better their product and increase our security in our neighborhood. So that is what we are talking about. We are not trying to build all these products. We are only trying to integrate and make it better for the community. So yeah, we were talking about our competitor Rescue Me. Rescue Me is not actually our competitor because we are not trying to compete with the police. Police is the #1 chief officer of the state, and we can't compete with them. We are only trying to make their work better and efficient because that's one of our problems. For users to get efficient platform and information about crime happening in their neighborhood. So we have Rescue Me, we have police e-crime record, we have EFCC people app. All these things are for the citizens to report crime. And we have looked at them, and the scope of their operation is limited, and that's why we are coming in to further this. Because EFCC only works about financial crime. The police e-report app, we checked it out, it only works about financial crime, cyber crime, and sexual abuse. And one thing this app have is the only EFCC have allowed for anonymity. The rest does not have for anonymity. You have to input your name and all, which will be a challenge for many cities like, oh, I don't want public harassment, I don't want them to know that I report this crime and all. So moving forward, talking about the neighborhood, like reporting crime, we're only talking about now, a crime is ongoing, you come into the app to report, and let other citizens avoid going to that situation. Maybe, okay, they are fighting in Mokola, they are shooting all around. You come into the app to report with use of video user with text, color, video, and live camera. So you are now trying to like prevent other people from going to that arm. So you are preventing other people from going to that same arm that you are going to. So it's not like, so going about the question I said, how do we enforce police to go into this? So now we can't really force police to go and investigate and all. But what we are saying is this: when you come into the app, report this crime, with our AI at the back end, we send out this information to police to investigate. And this is where it gets interesting. Okay, police may not actually go to report to investigate and hit, but monthly we are working on. Yes, we are working on generating and sharing data inside and crime incidents and sharing with our users. So every month we are going to check our app. This is the number of crime that has been reported. How many of these cases did police take up? Then, so every month we'll be publishing this monthly for everybody, and we are going to invoke public opinion to get police to do their work. Now we are going to be improving safety, awareness, and decision making of the police to better their work and improve on their services.
Verification. How do you verify?
Okay. Yeah, verification. Yes, this has been a serious challenge for us on the part. Like, how do we ensure that all the information we get is effective? Now, even the US states, the 911, they get thousands of calls every day which are false alarm. So we know that we can't. This is a very serious something we cannot eradicate. And these are the three possible solutions we are looking at. One, user education. First, user. Sir?
Say you're anonymous.
Anonymous user education. You don't like user education through social media like webinar. Okay, this is the main reason you should give adequate and true information.
They don't assume, they don't know why they should.
Yeah, we know what. People know they should not commit crime, but they give information. But because of that, they can't say we don't educate.
Anyway,
so number two,
the question was verification.
Yeah, I'm coming to that. So number two, we will make sure that we have this user loyalty reward. Whenever you submit a crime to us and it's effective, other users will be able to come in like, oh, this.
How do you verify?
Yeah. So others will have like, oh, you saved my. So others will have like, oh, this information actually saved my life. When they comment and upvote this thing, we reward you with token, and at the end of the day, every monthly, you cash out this token with airtime, gift card, and cash rights.
Sorry. Customer acquisition.
What is it?
Customer acquisition.
Customer acquisition. Word of mouth, social media, partner with NGOs and security systems. Yeah. Yes, sir.
Wow, okay. And so, please give me a round of applause. All of the participants so far. Yeah, it hasn't been an easy journey. They've gone through a series of trainings. Not only trainings, they brought out prototypes, models that were rejected, that they told them go back, go and do this, consider this. And they have come back and they have presented these lovely works to us. So I just want you guys to give yourselves a round of applause. And audience, please also help me congratulate them. Alright. So we will now be inviting our judges one by one, or if one judge is making one comment. Okay, so we'll invite the judges to give comments on the presentations, all of the presentations. So please, participants, listen well, not just for now, but for other times when you will be involved in programs like this.
Good afternoon, everyone. How are you doing? How's it been? Hope you enjoyed yourself. Yeah. Well done, everyone. Please, a round of applause for yourself. So, I can relate because I have also attended hackathons before as a participant. I've pitched in a lot of places, even while on campus. I finished from UI, by the way. So while on school, I did Hot Prize in 2016, yeah, and some other, cool stuff. So yeah, I know how you're feeling right now. I know the tension. I know, the hunger, the thirst. I also know the feeling that you just want to be right? You want to be the right person. You want to win, right? But what you need to know is sometimes not just about the winning, right? So it's about learning. Most importantly, because trust me, this is just like a step to your journey. Some of you will still pitch at like many big stages, bigger stages, and just see this as a learning curve, whatever the outcome is. So I just have like a couple of tips generally, so I'll not be giving specific feedbacks. So I have like general tips for you. So as an entrepreneur, as a social innovator. So one thing is never ever underestimate the power of talking directly to the market. So whenever you have an idea and you want to execute, you know, the euphoria, the zeal that just build, resist that what you just built. Like resist it. First of all, take your time, research very well. Because for some of you, if you have actually researched or actually talk to the right people, there are some things that you are saying here that you will not be saying, right? So yeah, talk to real people, understand their pain points, which I'm sure is actually what you've been learning for the past, 72 hours. So and then, you develop some sort of empathy so that you can actually, solve the problem from the user's perspective. So that is that. And then another thing I also want to take note, very important. Don't underestimate the power of cash flow. Cash flow keeps you in business. A team actually pitched and I can't say anything, I can't say any figure. Like, how do you want to survive? Because out there is the economy. Like, you have to give a value to receive a value. So if you cannot give enough value to receive a value, you will not sustain, you will not survive in the market. So please, any idea you are building, whether it's for profit or not for profit, numbers are very important because you need to survive, right? So and then the last thing I'll be sharing with you is that, and which I'm also sure they must have taught you in the last 72 hours, that, and I'm also echoing what Dr. Simpa said, that sometimes the solution is no technology, right? Not all problems can be solved with technology. So before you even think of technology, like look at it, look at the problem, the peculiarity of it. Can this thing be solved like by one or two things without involving technology? Would that be effective? If it is more effective, then sure, that should actually be prioritized. And also, your MVP is actually very important. Now, I'm sure that the winners of this competition, you'll be given some money, right, to test, your ideas. Why some? If you're not getting money, you probably say, okay, you want to raise funds to actually test your idea. So generally, let's assume that, okay, for the guys that wants to build the substance abuse platform, so you're costing like, let's say 400K, right? So, and then the next thing you're like, okay, I need this 400K, I need to raise this 400K so that you can use it on tech. Don't just rush to say you're just raising that 400K, 500K, 1 million, and just put it straight into products, right? So you need to be able to devise a sort of a minimum valuable product, which can simply be a WhatsApp group, which can simply be SMS messaging system, which can simply be like a WordPress website, right? So always, solve from that MVP perspective, MVP angle, for you to minimize your loss as much as possible, right? Because if you raise a fund of money and then you push it to product, you realize, oh, I made a mistake, we should not have built it like this. The money is already gone, right? So, and this is actually why you are in a gadget like this, so that you don't make some not necessarily make some mistakes that some people have, I have made in the past. So once again, congratulations, and I wish you all the best.
Hello, good afternoon everyone. My name is Adejoke Lasisi. A big thanks to all the participants. Honestly, you guys did well. Within the short period, you were able to do your own work, although you still have a lot to cover, a lot to really understand. And as you have said earlier, you have said almost everything. When going for all these kind of things, honestly, you have to think about how you are going to make money to sustain that idea, that project. It is important. See, that is what investors want to hear. I'm not going to give you money and be saying just because I like your idea. And like he said another again too, that you don't really want that solution. See, some things that most of us see as a problem, it's not a problem to those people. They love it. In fact, they're enjoying it. That is what is making some people happy. That suffering that you are seeing as suffering that you want to create a solution for, they don't see it as problem. And if they don't see it as problem, will they buy your solution? I mean, if I don't have headache, will I buy paracetamol? So we have to understand that users, do they really need it? Because if they don't need it, it might just be a great idea, if that is where it's going to end. People will not buy it because they don't need it. So we have to understand that do they really need this solution? Because, you know, sometimes we're always happy when we think about an idea like that it comes to our head. Be like, everything, it will work out. Only you. You see, you can't be wearing size 40. If I build shoes now, make plenty shoes, and people don't like it, will I wear size 42 at the same time wear 35? Possible now. I can't wear everything. So I need people to pay for my product. So if you don't have those kind of people here, you are not in business or whatever this is that you want to do. You have to make sure that people really need it. So when you identify a problem, make sure that it is something that people really need. You don't assume for people. You have to find out. Customer discovery. Understand what they want. Understand why they would want your own idea over competitors. If you cannot understand that, if you cannot make them understand, if they don't tell you, I'm telling you, you are not in business. And number two again, you know, most of all these stuff that, because I'm very sure that this is just the beginning for you guys, you are going to get to higher places. Aside from this now, you are going to other places to go and pitch to some investors, you know. By the time, especially people that win this thing now for their prototype, you might want to like scale it or even start it. That okay, I really want to start this stuff. We'll be able to make something. We want to like, we now need money to make it in mass produce these things or do this stuff. Make sure that at that time, see, after this place, don't just say that okay, I have learned now, nothing more come, I have arrived. Do not make this place the last place, and do not feel like this knowledge that you acquired is enough for you, because what brought you to this stage is not going to take you to the next phase of your life. Especially if you want to go to a higher place, that means that you need to learn more, you need to know more, because you cannot give what you don't have. You need to make sure that this place, it has opened your heart, it has opened your eyes to some things that I think that we can even do better than this. I think those are the things that should come to your head now after this place. So don't just go and relax and go and sleep that what you arrived now, Sheba allow me first prize. Which first prize? So make sure that after this place, even if you don't win, do not just set that idea aside. And just because you don't win this place doesn't mean that your idea is not valuable, it's not something that can work. In fact, there are some people, I'm sure that you would have heard about some people that went to get funding and they could not get it at that time. But do you know that their company today is worth billions of dollars? So just because those people did not see it as an idea to fund at that time doesn't mean that it is not viable. Doesn't mean that that idea is not a great idea. So I want you to understand that you can always improve on that thing that you are doing. At the same time, be open-minded. Look at people around you. Look at the things that you can collaborate with. In fact, you can see some people here that you can collaborate with each other. So it doesn't have to be like only you that you have to like carry out that idea. So some of you can still work together. Thank you so much.
Good afternoon, everyone. It's been a pleasure listening to all of those wonderful presentations, and sometimes it becomes very difficult to be a judge because you start wondering whose idea will become the greatest in the future. You don't know. We're all humans. We might say this is the best, and God says no, that's the best. But we can only judge based on what we hear, what we think, the limited knowledge we have. I can imagine some years ago if somebody had said, I'm going to build a device that you don't have to go anywhere, you can just sit down, call, and then they'll bring your food. They'll be like, wait, how? You have to cook, nobody's going to bring anything. How would they even know? How would you even talk? There'll be no wire, just wireless. What wireless? How? Today, that's how we do it, isn't it? We just order and we bring it to the house. So clearly, some ideas are beyond the comprehension of those who are the judges. So the fact that you win or you don't win, it does not tell the future. It just gives an encouragement to you. But let me say something. Let's appreciate the results of this particular event. it's always important to think of problems and possible solutions. The problem is not that, yes, I mean, it's not about you solving the problem of now, but it's about you being ready to solve the problem of tomorrow. For example, when COVID-19 came, we all started running helter-skelter. There was no more the time to have group meetings like this. We all had to be locked at home. Only those that had solutions would come out and say, oh, I can build a defibrillator, or I can build a ventilator, or whatever. At that point, quick thinking was necessary. And only someone that has been through programs like this, that knows what to look out for, can come up with ideas. And of course, when you eventually start your own business, it might not be the idea you started here today. In fact, you might even look back and say, oh, that was a funny, childish idea. I had no experience then. Yes, it's always like that. But more importantly, critical assessment of your ideas. So as judges, when we try to correct you or give you deep insight into what you're talking about, it's not that we're trying to, make you lose confidence. Because I know when you're going for a program, you think the judges are there to shake you and see if you have confidence. Well, it's part of it. But more importantly, it's an opportunity for us to, within that short time, quickly give you something to think about in the future. Because you might think this is the solution, but from experience, we can tell you that's not the solution. So most times, just take it. Nobody was trying to make you lose or trying to destabilize you at all, but just hoping you can see beyond your nose right now. So why I have to say this is that sometimes you have great ideas, you believe so much in your idea, but when professionals give you advice and you don't take it, it can lead to some events. For example, you know the latest one, right? Who wants to tell me? Nobody? Ocean Gates, right? Best idea, it lasted at least 5 trips or 6 trips, but the 7th trip it crashed because there was no enough simulation of what could happen over time. So sometimes your idea might be great, but if you don't listen to professionals, it might not be a very smooth ride eventually. Humble beginnings, always appreciate humble beginnings. You have a great idea, nobody appreciates it, do not stop. That does not mean you should stop. Push your idea. Get to a point where investors can now say, oh, why didn't we invest in this idea? For example, I can't remember the company now, was it WhatsApp or so, that when they started, a company wanted to buy them. I'm not even sure of the company right now, I'm just making things up now, but there was a company that someone wanted to buy for an amount of money and they refused to sell. Then eventually they became a very big company and eventually they sold at a higher price. I'm not sure if it's WhatsApp or so. There was another business as well, I think it was Skype or Yahoo, I'm not sure, that they were supposed to sell when they had the best market, but they didn't sell, and now nobody wants to buy it from them, something like that. Now, lastly, you all mentioned competitors. I mean, all the teams mentioned competitors. But I want to bring this to your knowledge that, see, not all the time are these people your competitors. Some businesses are truly your competitors. Some businesses are your collaborators. Some businesses are your source of clients. Some businesses are your sink. That means that determine where you are going to be on the value chain. Okay? Let's not always recreate ideas or recreate the solution. For example, there is Uber, there is Bolt. I'm not sure what else is there. And then you bring your own again. At the end of the day, you're just having competitors all around. How about you look at how you can service these existing companies? For example, Uber runs an app service. Bolt runs an app service. How about you tell Uber and Co that, see, you know what? Don't run your app service. I'm going to run an app service that allows you to choose between the two of you. And I'm going to make sure that you get as good a market for a particular region of your interest. So for example, if Bolt says I have 10 drivers in Lagos, and Uber says I have 100 drivers in Lagos, and then Bolt says I have 100 drivers in Ibadan, and Uber says I have 10 drivers in Ibadan. Okay, Bolt, I'll give you all the markets in this other place, and Uber, I'll give you all the market in this other place. So they can now happily coexist, not spending the same amount of money to run their businesses here and there. I don't know if you're getting my point.
So just know that there's that dark side of entrepreneurship. So don't just think about all the money that you make and the potential to be glamorous and all that. But just know that it's a balance. I've lived an exciting life despite that issue. I don't think I will exchange it for anything else. But it's just that people should be aware so that when it happens, you don't think that you're the only one that's in the world or the one that's come from an end. It's just a phase. You will come out of it and you get better at it. The second thing I want to talk about is some and don't solve the problem that you like. Right? The other way to say it is that don't love your product more than you love the market. Okay? And it's not everything that you must defend. Right? We're all learning. On Tuesday, I'm going somewhere to go and pitch. Right? Because maybe the money might be different, but we're all pitching. It's a way of life, right? So, but don't love the product more than, don't love the idea more than the market. Because the final appetite, the final person that says whether you're successful or not, is the market. Right? No matter how much you have said, and don't do that, that's social media, they don't tweet that. Mark, my brother, did his own. In less than 24 hours, he has 30 million people there. Right? Because there was a need, right? And that's the validation, right? At the end of the day. So the validation really is users and, more importantly, people that will pay you. The second thing to say is this: when you think about your market, it's not the person that is using your service that must compulsorily pay you. In fact, when you can master the art of being able to provide service to one person and collect money from another, you have unlocked maybe the biggest way to run most stuff. If you look at most of the social media networks, right? Google operated essentially from that point of view to become what they are today, largely, and search is free, right? But advertisement is paid for. Twitter, you almost say the same thing, right? Facebook, you almost say the same thing to a large extent. So think about that model, especially within healthcare and other things, right? Can you provide a service and get money from somewhere else, right? And think about that. Also understand the power of platforms, right? The power of platforms. So there's value in creating a community, right? And one of the ways you create a community is to provide a platform. So whatever you're doing, ask yourself, is there a way to create a community out of it? And in most instances, some people say that maybe you should create a community first before you create your product, right? Somebody mentioned here that, oh, can you set up a WhatsApp group? Because you're more likely to be successful if the community is telling you what to do than if you are trying to use your head to break the wall to find what to build. Because it means you already have a market that is going to adopt whatever you build, right? So leverage the power of communities, right? Leverage creating communities around your customers. You cannot do an app for doctors and go and create a community for lawyers. It doesn't make sense, right? I think that's really this. I mean, everybody has done brilliantly. The experience, the journey is much more than the end product. Like I said, call these guys in 2 weeks' time, all that money has finished. Alright, so don't worry yourself. It's not really about the money, but it's about the knowledge, it's about the engagement, and it's about the fact that you have a reason to dream. Right? I think that's the biggest thing really that you can take out of here, that you can dream something and see it come to pass. Thank you.
It's about all the change that we're able to make along the way. So congratulations to everybody here. You're already a winner. But somebody will walk out of here with a big check. That's what I know. So just to remind everybody, our contestants were actually competing for a total cash prize of 600,000 naira. Our first prize team is going home with 300,000 naira. Our second prize team will be going home with 200,000 naira, and our third place team will be going home with 100,000 naira to go and be able to work on their prototypes and implement their design. We're about to announce the winners of the maiden edition of Innovate for Impact Designathon. Thank you. Please allow me to soak it up. This is the most important I will be today. As I'm announcing these winners, I've gotten some privileged information from our judges here. They have sat down, they have unbiasedly judged
the content that was presented before them today and arrived at these 3 winners. Sorry, winners, because we are all winners. And so, we'll be calling the 3rd place team. Please give a warm round of applause to Please welcome the 3rd place team of the Innovate for Impact Designathon, Team Safe City! They were our only 3-man team, and yet with the apparent disadvantage, they still managed to place. Well done, team. Thank you very much. Congratulations, Team Safe City. Please give them a round of applause. Our judges and our esteemed guests should not get too comfortable on their seats. We are about to announce the 2nd place winners. Our 2nd place team. What SDG do you think it was? Just shout. Which SDG? 2, 3, 4, or 16? Let me hear. Which SDG? Which SDG? 3, 4, 3. Alright. So, our 2nd place winners for the Innovate for Impact Designathon, please welcome to the stage Team Break Free! Alright. Everybody's a champion. We're all winners. But only one person is going to collect the grand cash prize of 300,000 naira. Please. Thank you, teams. Who won it? Sorry, I want to just confirm again. Wow. Sorry, please, if you made your bet, it's time to start checking it now. Your odds, just be checking it. Our 1st place winners. Can you guess? Actually, do you want to hazard? My money is there, so, taking a grand cash prize prize of 300,000 naira for their prototype and innovation. Please welcome with more now. Give a standing ovation to Team Health all the teams should come forward, all the winning teams. All the winning teams.
Stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up. Stand up, stand up, stand up. Here we go, it's getting close. Now it's just who wants it most. It's just life, that's how it is. 'Cause we have our strengths and weaknesses. Oh, I have vision, oh, can't you see? I'm on the move, make way for me. So stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up.
I'm where you are not to be. Last 3 days has been, I don't even know how to express. Very hectic, sleepless nights, fighting, arguing on ideas, bringing up ideas and you bringing it down your own self because you realize it's not feasible, and everybody has been, it's been a very hectic one for each and every one of us on this team. Everybody had something to put on the table, like the technical skills, the ideas, experience. It was really a lovely one, but very hectic from my end. It was really very hectic. But it was a very wonderful experience, like staying in the same confinement with three other people and thinking about one single problem, different problems, trying to find just one that you want to use and create a solution for. And out of that problem, seeing a lot of solutions that you can actually create and finding one that will actually work.
I'm Jeremiah Daniel, and this is the first time I'm working with these people, meeting these people, with these guys. I actually was blown away by the fact, by the multi-disciplinary team we had, and also being able to invent ideas that can really work and invent solutions to those ideas.
My name is Bashara Abdusalam, and the problem that we're trying to solve was the lack of compliance with medication among young Nigerians. So we realized when we're ideating that the major problem we are currently facing in Nigeria is that many people suffer from chronic medical conditions that they will likely be treating until they die. So we realized that to treat these conditions, they have to be taking medications. But the problem is that many of them forget to take this medication, and sometimes if you don't take these medications on time, this can lead to complications. So we realized that, okay, we've identified our problem. Why don't we build a solution where we can actually remind these people that, okay, you are due to take your medication at this time, you miss your medication at this time, you took your medication correctly this week, and you have made this progress, this certain amount of progress. So we also paired it with the fact that we can have an IoT device that can actually track your drug usage. So whenever you take your drug, it checks you for that day. Whenever you don't take your drug, it also checks you off for that day.
Actually, at the beginning, it was quite hazy because I never thought we would win. On the second day, we were still arguing on what was our problem. What was the problem we want to solve? We had not, as of the second day, afternoon, as at 2 p.m. on the second day, which was more than half of the time that we had spent, we had not even decided on what problem to solve. But as a team lead, I was very happy because everybody was on a unified front. We all came together. Okay, even if you feel like your idea is good enough, you drop it. As long as you see that there is a lot of possibility in another idea. So we had to come together in unity and work things together. So be able to choose one single problem that we wanted to face, and we stood all front, we stood all out to solve that problem. And it was a very great opportunity working with this team sincerely. And I know we are all happy. Sincerely, we are all happy because the sleepless nights we had close to 72 hours. Some of us slept for only 2 hours in the past 72 hours. And it's been a very wonderful experience. It's been a very wonderful experience. And the thing, it came out wonderful.
I'm very happy actually for winning this Designathon actually. Because it's very like, it's almost like a dream here. And one thing that's very kind of stood out is that all together, before we came out final solution, we built up like 6 to 7 ideas that we like ruled out by ourselves because we knew that we like realized that they were not feasible. And at the end of the day, we eventually like come out with one tangible one very feasible one. So I'm very grateful for that.
Yeah, I'm Akintola Akindele. So for the last 3 days, it has been challenging and draining actually, but it has opened a new opportunity for us, meet a lot of people, new ideas, networking and the likes. So it has been really challenging and interesting actually.
My name is Mustafa Musliuddin, and I can tell you that I really enjoyed everything that has gone through this process. You know, having the opportunity to be selected right from the selection process, coming down here to meet different people from different diversity, having to think together, profound the solution. It's very spectacular, despite the fact that what we get to, it was too hectic. We couldn't sleep at times, but all in all, we are excited that we have this with us.
I'm happy to be here. It has been an impactful experience, learning a lot of things and eventually working with my colleagues together to determine and review. We thank God for this experience. Thank you.
My name is Folu Adejini, and this is Ileri Ogolua, and here is Ara Janet, and the other hand we have Femi. So that makes us 4. We're Team FIFA, and really it has been a very fantastic and grueling race. You know, I won't call it a race. It's a marathon, yeah, but then design thinking kind of marathon. So from the design thinking process, the ideation, yes. I mean, us having sleepless nights over societal problems. It's everything for us. It's everything for us. So every step, every stage of the ideation has been nothing short of awesome. And I just want to extend my sincere gratitude, my appreciation to the organizers of this event. It's really eye-opening. Yeah. It's really eye-opening and it's commendable. So in the next future, if something like this comes up again, I'm ready to go all in. Even though we came, okay,
we don't know.
Alright, so yeah, it's been a very super experience. Thank you so much.
Thank you, Innovate, for giving us the
Thank you, Innovate, for impact.
Oval and TIDA.
Yeah. OTTZ.
And the problem we're trying to solve is that we identified that there's a problem with substance abuse, and then these people actually need help, and then we had a series of brainstorming process trying to figure out what would be the best pathway to find solutions to the problem. But then we realized that our initial plan was not even something we could end up going with. We had to brainstorm again and go back to our drawing board. We realized that okay, people with this substance abuse are not even the ones that will seek the help by themselves. It is their caregivers, their parents, probably even people around them. So we leveraged on that, and then we also tried to find data that will back up what we are trying to propose. So what we did was that we pitched a mobile application that is able to provide some features, like we had the tracking system, we had the gamification system, we have the recovery plans there, we also have motivation, we're able to give reminders, and then one other thing that we leveraged though was that we had a section for providing psychoeducation as well as behavioral therapy, because this is one of the major important part of it. And then we leveraged on the fact that the clinicians are the first line of contact where these people actually go to. So we said, okay, what if our mobile application is being recommended by the clinician to the users as well as their caregivers, probably, and their family that is also able to track this system with them. So that is what we did. And then, okay, probably that at first we didn't have a team name. Our team name came in yesterday night. So everybody was calling us Team is coming. So I think we finally arrived now.
So I'm Awal Adebisi, and I'm the product designer for the team in mechanical engineering students also from the Federal University of Technology, Accra. So how do you feel about winning? I'm sure every single person is excited about winning. So funny how yesterday night I was telling them around 2, I was telling them that, okay, I want our pictures to be on Futa website. They didn't get what I was saying, yeah. I didn't sure that's what I was trying to say, that I really actually wanted us to be. We were tired, frustrated, because our ideas at that point got messed up. We felt like we could, at this point, should we just run it? So, but it's too late to give up, yeah. You want to do you should kind of thing, Yoruba will say, yeah. So I feel amazing. I feel blessed because I think it's my first hackathon since 2019, and this is the first hackathon out of 4 that I've attended that I'm winning. So I feel it's a big adventure and a big progress in my journey of attending competition. So it was nice working with this amazing team. It was like brilliant for all this. So I feel elated. Thank you very much.
Hi, I'm Paul Uluani, student of pharmacy, University of Illinois, and also the creative designer for the team. I would say it was a challenging experience. It was challenging in every phase of it, right? But I am sincerely grateful to God and to the team. You know, the courage to allow our ideas to be critiqued, you know, to be literally washed down and then to pick it up again. Hearing other people's opinions, you know, either it sounded good to us or it didn't really sound good. But you know, we welcomed, you know, critics and all that. We sent out questionnaires. We were just taking it one step at a time. There was pressure, of course, there was, you know, but just to get a step at a time. I was so grateful that we could come up with this. Yeah, 200K.
I got to work with new people. When I came here, I never expected, you know, we the selected participants to work in a team.
And for the past 3 days, I've been a participant for the Youth for SDGs Designathon organized by TIDA and Innovate. The past 3 days have been everything: hectic, exciting, impressive, delightful, and of course a wonderful learning experience. I've learned about the user map journey, I've learned about ideating, I've learned about creating a user persona by empathizing with the persons that you really want to help. And I've learned that most importantly, that the solution you want to solve must also solve your own problems. So that means that for every social enterprise, there should be a way to garner income. And for me, I think that has been really new, because I always thought, you know, you help persons and it's just a matter of you always giving. But I've learned that to help and to help effectively, you must give and you must also receive. I do look forward to joining other activities that TIDA and OVA would be doing.
Well, to be frank, I never expected I would make it to this stage. And when I even got my the application, the successful application, I was a bit surprised and I wasn't too sure about what was coming into. However, the set of people and the kind of people that I met down here gave me they gave me a nudge, they gave me a push, because I felt, yes, if they are here and I am here, yes, then we can definitely create a solution, and we can come about ideas, and we can come about innovative models to tackle certain SDGs. And it was really cool meeting my teammates, and we had to like stay in an enclosed area for almost 72 hours, thinking of solution, trashing old ideas and bringing up new innovation. I'll tell you, it's not easy, but we came up with a solution, and I can definitely say that yes, I am proud of my solution, and yes, my team did it. Thank you very much.
This is my first time engaging in a Designathon, and to really meet a maiden edition that is this excellently planned. I mean, the feeding was very okay. Our accommodation was the best. Even the pairing of the teams, because you do not pick your team member, they pick the team member for you, was excellent, because it's so wonderful to realize that these people have gone so in depth to actually pick members that are able to supplement to the weakness that you personally have. And so I'm very, very grateful to the organizers of TIDA and over, and I wish them all of God's best as they continue to empower young youth in Nigeria.
I'm Angela Ideri.
I am Yusuf Babatunde.
I'm Abdulhamid Babatunde. I'm Mubarak Ali.
And we are the steering committee, part of the steering committee for the Innovate for Impact Designathon. It's something we've been planning for a while, and then for me the process has been both tedious and interesting, because this is the first time all of us are coming together to put this together, right? So it's been very, 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 very interesting. We've had to really task ourselves, do stuff beyond what we've done, and it's been very, very interesting for me.
Yeah, for me it's also like really interesting, and I'm very happy about today. So we started planning since January when we had the idea, and the founder reached out to us, and we started having meetings every week, and sometimes we have meetings till midnight and we're able to actually actualize some things that we also learned over the years in TIDA and some other experiences that we've had, and we are happy that we're able to implement them here, and everything turns out beautifully well.
For me, the Sunday's meetings have been delightful, and it has been fun and engaging. Plus the weekly task, every Sunday we get tasks from Yenny, and Yenny is so much organized, and at least everything you see your task, you have a task to carry out for a week, then come back the next Sunday, tell us what you have done and what you wait for. It has been fun and it has been interesting to work.
This was my first time being part of a planning committee for an event like this. I think it was my first time as a physical Designathon as well. So it was a lot of new learning experiences for me, and I really, really enjoyed going through the processes, talking to vendors who did not talk back to me, who kept posting me. It was just very interesting to see all the behind the scenes work that actually goes into host an event like this, and it was a very wonderful experience.
So in the past 72 hours, the creativity, the passion, the talent that we've seen among young people has been mind-blowing. It has shown that when we allow young people lead, when we give them the tools, the resources, the mentorship, the training, they can actually own a problem and they can actualize, give solutions. And this has really shown that we need more of this, and we're basically just starting. Expect more Designathons, expect more open calls, expect more innovative programs that leverage on the power and resilience of youth to design innovative programs that address different problems in society.
Yeah, for me, one important thing is that we, in the process of designing this thing, we try as much as possible to reduce having people that already have expertise in what we want to teach. So we try to make sure that the judging criteria for selecting people that participate in this competition does not require you bringing up an idea or something that we are already trying to do in this program. So a lot of people are here that this is their first experience, and I'm sure people have been able to get exposed, and the judges also give criticism that we actually help them in subsequent pitches and innovation. And definitely we expect to do more of this in the University of Ibadan and some other places where we want youths and young people to actually identify problems and solve them, and not just be people that complain and just make threats about problems that are happening, and think about how can we actually solve it even in their day-to-day activities, not just entrepreneurship.
Keep creating.
Go youth.
Youth Designathon for the SDGs.
Right. Thank you.